My next guest is chatting with me today about two issues that are incredibly common and more connected than most people realize: hearing and balance. Dr. Allison Vega is an audiologist and the founder of Complete Hearing and Balance in Olympia, and she's here to help us understand what changes to really watch for and why early conversations make all the difference. Hello.
Hi.
Thank you for being here.
Yeah, thanks for having me.
So often hearing problems can be gradual. So what early signs might people kind of overlook that they need to really hone in on?
Yeah, so I think we all know people who are asking for repetition, turning up the TV louder than anybody else in the room wants it to be. Those are some really good telltale signs, but also it's people who are complaining of ringing in the ears. Ringing in the ears is an early sign that there's something going on with the hearing system. And it's also people who are saying things like, I can hear, I just can't understand. That is definitely a sign that there's something going on.
Okay, gosh, I did not know about the ringing in your ears,
Yeah.
so that makes sense. What other parts of someone's life can hearing loss impact? I imagine really everything day to day.
Absolutely. Hearing health is really part of our general health. So if you think about hearing loss, oftentimes we think about balance. Mm-hmm. So if you have problems with your balance system, you could have problems with your hearing system. Also, cognitive health. So our brain health is related to our hearing. If the hearing system is not sending the right kind of information to the brain is then having to really grasp at straws and trying to figure out what's being said because it's not getting what it needs from the ear. So that's when people are like getting context cues. They're reading body language, they're watching lips, they're trying to figure out what's going on. Well, the brain's now working overtime. And people are working really hard, which then causes stress, it causes auditory fatigue, and that's really hard for people to do long term, which can then cause irritability, stress, it can cause sleep disorders and just make them tired over time. But then really long-term effects of that is the brain starts to reorganize and it actually changes shape. And that's been related to cognitive decline.
Yeah.
Some other problems that we're noticing with hearing loss is heart health, because the ear is fed by blood.
Wow.
And so if there's cardiovascular issues, that's going to affect the hearing. But then mental health, if people are having a hard time communicating, they're going to feel depressed.
Yeah.
They're going to withdraw. They're going to feel socially isolated. But then something interesting that's come up in the past few years is about women's health. And women in menopause are noticing that they're having hearing loss,
Really?
ringing in the ears, itchy ears, and vertigo.
Oh gosh, don't get me started on vertigo. This happened to me, it's the worst. Can you explain too how the inner ear supports both hearing and balance too? Because you talked earlier about this connection and many people don't realize it's connected.
Yeah, so the inner ear is actually comprised of both the hearing system and the balance system, and they both send information to the brain on the same nerve. So the cochlea is where the hearing is processed, and the vestibular system is where balance is processed. And they both send information to the brain about where we are in space.
Okay. I have a best friend, I'm not going to put her on blast, but she was having hearing loss and didn't want to go in because she was worried about getting hearing aids. So can you really let people know what that first consultation looks like?
Yeah, that's actually a really common concern of people, especially younger people.
Yes.
But anybody does. So when patients come in, so I have a practice and we're full scope. And so when patients come in, we are really trying to help them figure out what's going on and if it's related to their hearing or balance system. So the first evaluation is really just a discovery appointment. It's for people to come in and get answers. It's to, we ask a lot of questions to try to figure out what's going on. We look in their ears to make sure it's not earwax blocking. We test their eardrum system. We test their inner ear system. And then we can give them results and really educate them about what's going on with their hearing health. Hearing is something that you can't see, right? And so when people have these, like I talked about, the other impacts of health issues in relationship to hearing, you just don't know, is it my hearing or is it something else? And so that's our job, is to really educate people and then recommend treatment if we think that it's appropriate.
Knowledge is power. And how important is it that we start these conversations early before really the symptoms get extremely serious?
Oh, early intervention is really key. I think that it's really important for everybody to have a baseline hearing exam. They should be preventing noise exposure, so limiting headphone use, wearing hearing protection when exposed to loud noise, because noise-induced hearing loss is 100% preventable. And then if treatment is recommended to people, they should be taking it. They should take that next step because early intervention will protect their cognitive health and overall health of their body.
And we think about this a lot of times with older adults, but this can happen really at any age, right?
It really can, yeah. We test people in my practice of all ages, babies to geriatric, and we see hearing loss with all sorts of causes.
Okay. And how do you bring this up to someone that is maybe a little nervous to take that next step to come in and talk to an expert?
Well, I think it's really important, like I said, to just let people know that it's just to find out what their body's doing. We get our eyes checked. We get our heart checked, we get our teeth checked, we get all sorts of things checked, but very rarely do people go in and get their hearing checked because they're afraid of getting hearing aids or something like that. And I think it's just really important for people to know if they have a hearing loss or not.
Okay, and before we leave, where are you located? Because it's the South Sound, right?
Yeah, we're in South Sound. I have 4 practices. I have practices in Olympia, Lacey, Chehalis, and Yelm.
Oh my gosh, amazing. This was really exciting. Thank you so much for being here today.
Yeah.
We really appreciate it.
Thank you so much.
And Complete Hearing and Balance is offering a complimentary 30-minute consultation appointment for New Day viewers, so get excited. Just mention New Day when you schedule to receive the offer. Consultation could be especially helpful for people who are noticing difficulty hearing conversations or the TV, like we mentioned, feeling unsteady, dizzy, or concerned about balance, and have ringing in their ears. If they're currently wearing hearing aids too, but feel like they're not working well, that's also great to come in. And of course, people who live in the South Sound area of Olympia and beyond.
New Day Northwest is sponsored by Complete Hearing and Balance.